Alzheimer's, and it's pieces of plaque that come together around the neurons, and then it inhibits the messages to go in between neurons. And there's an illustration of what they look like. And then also neurofibrillary tangles or tau tangles show up with people who have Alzheimer's. And there's a delivery system in the brain that delivers the nutrients, and it runs on a parallel structure. And when these tangles occur, it causes the tau protein, which keeps the delivery system parallel, to collapse and disintegrate. And then the delivery system, it doesn't transfer the nutrients and things like that to the other neurons that need it.
So pathogenesis, with Alzheimer's disease, there is atrophy of the cortex of the brain. Also, the effects of the amyloid plaques is that they inhibit the transmission of chemical signals between the neurons in the synapse. And also there's a degradation of the neurons in the brain, which it causes basically your cognitive functions to decrease, and it just it decreases along with time. Also, the effects of the neurofibrillary tangles, basically, as Anna explained, there's this parallel structure, and once they disintegrate, you can no longer transfer these nutrients that are needed, and the neurons in the brain will die. So here's an image showing a cognitively healthy person and then a person with Alzheimer's disease, and you can see the areas of inflammation affected by Alzheimer's disease. And here's our visual walkthrough. So here is a healthy neuron, and you can see how the tau protein is holding this track in place. But with a diseased neuron, the tau protein collapses, and this track starts to disintegrate, and they also form these giant masses inside the neuron. Also, the amyloid plaques are formed from the cell membrane, and it is cleaved off from the cell membrane, and they stick together in this mass, and it inhibits the electrical signals between the neurons. And this is the synapse, and basically the tracks also help to transmit the electrical signals through the synapse to separate neurons. So when that tau protein collapses and it causes these tracks to disintegrate, they cause these to also not function properly, causing a lack of communication between the neurons. So the clinical course, there are 3 stages of Alzheimer's. The early stage is the first one, and it begins in the frontal and temporal lobe of the brain, which is towards the front. And this is when the formation of tau tangles and plaques first begin. So the patient usually doesn't notice major changes, but they may begin to notice slight changes, such as the names of their friends, but they may think of it as stress factors or just simply getting older. And usually, these changes aren't noticed until 10 to 20 years after plaques and tangles form. So here we have an image of the brain with mostly, this would be a healthy brain or one that is afflicted by the early stages of Alzheimer's. So you can see that this is the outline of the brain, and it's pretty complete, and the ventricles aren't enlarged, and the hippocampus is still a relatively good size. So then the second stages are called the mild to moderate stages. These are about 2 to 10 years after the changes are noticed, like those minor changes or lapses in mental function. And so these plaques begin to spread around the frontal and temporal lobes, and they begin to spread to other areas of the brain as well. And family and friends also will notice differences with the patients and the way they comprehend and think about situations. And also this is when lifestyle changes, and many patients will need notes or reminders or alarms to remind them of certain things because they can't remember them. And also, here are some other things that a patient with Alzheimer's disease can have trouble with, and they really struggle with everyday tasks, and it becomes a major problem in their life. And here's another image, and you can see how the outline of the brain has become compromised and is starting to degrade. Also, the hippocampus is getting smaller, and these ventricles are getting larger. And the last stage stage of Alzheimer's disease is the advanced stages, and they're about 1 to 5 years after the mild to moderate stages. And basically the plaques and tangles, they spread throughout the entire brain. And there's major destruction of the cortex causing atrophy of the brain, which is when the brain becomes noticeably smaller and scan. And also patients lose their main abilities to communicate and comprehend and care for themselves. And usually this is the stages when a patient will require assistance from a caregiver. So again, there's difficulty with everyday life, and these are some major things that they could have difficulty with. Also, a major hallmark of Alzheimer's disease is that we get to relive memories from their past, which can be confusing and difficult for other family members to deal with. And this also degrades close relationships that the patient has with their close family and friends, because it's harder for them to understand and remember things that their family and friends say. So here's a comparison showing the amount of atrophy of the brain, and you can see how much the outline has changed, and also you can see how big the ventricles have gotten. And here's another image, and here you can see the whole brain with severe Alzheimer's, and you can see the hippocampus a lot smaller compared to the normal brain, and the ventricles are a lot bigger, as well as the outline of the brain has become a lot smaller.
As Alzheimer's becomes more severe, the patients may have more trouble with things like eating and bathing, and that's when a caregiver may need to step in and assist in these things. And also they begin to wander around, and because they're not sure where they are, they get lost and confused, so they may need to be put into an assisted living home where they can keep track of where they are and so they don't wander off. And then there are a couple drugs that will help delay the progression of Alzheimer's, but it won't stop the progression and it won't reverse the symptoms. There's donepezil,